So usually about 2 weeks after their surgery, we would get started with them with the prosthetic process. We'd evaluate them in one of the treatment rooms over here, make a cast of their residual limb, create a positive mold from that casting, and from that we make a socket similar to this. And this is a thermoplastic socket for an upper extremity transradial patient that we would do first a check socket fitting, and this allows us to make sure the socket fits proper from the get-go. If we need to make some changes, we can heat up this plastic socket, make it comfortable for them, and once we have achieved that, we go ahead and proceed to adding the componentry to the prosthesis. After we've created a socket, they take the socket, which is still on the mold, and they take it back there and they would cut it out with a cast saw along where the trim lines are, take it off the mold, and at that point they would smooth up the edges on the trim lines of the socket so as not to cause any discomfort on the patient. Sometimes to get the socket off the mold, you have to hammer, pound the socket off of the mold itself. If the shape is a little bit bulbous or a little irregular, it may be hard to take off. So we use air compressors to help take off the socket, along with hammering and pounding that off. Sometimes we have to break out the plaster Paris before we can get to the socket by itself. And then from there we'll take that socket and take different components and attach it to the socket after they've trimmed it up back in the sanding room. We use different components, different hands, different wrists, different elbow systems to customize each prosthesis. Each socket is a customized device or component. The sockets are customized to each individual to make sure they are fit proper.